All right, everybody, welcome back to the Integrative Health Coach Success Podcast. I'm Dr. Steve Cabral, board certified doctor of naturopathy and founder of the Integrative Health Practitioner Institute. Excited to get started today because we're going to be talking about how much should a practice pay you as a health coach. And I think this is an important topic to go over. This was brought up on our IHP Mastery workshop, and it was a great question. And so I wanted to share with you from someone that has hired many, many health coaches, as well as been a practitioner inside of another larger integrative health practice. So just to share with you, when I was, and I shared this on IHP Mastery. So when I was studying for my boards, I wanted to give myself about 3 to 4 months, more towards 4 months. I didn't want to stress out about it. I wanted to be able to study. There was like, I can still remember it to this day because I put in the time because you don't want to take your boards twice. Like that's not an ideal world, whether you're a doctor, whether you're an attorney, anyone. You just don't want to have to study twice, and you can't really practice until you get that, or for most places. So I said, I'm going to put in my time. There was 42 books on the list, 42 books that were suggested reading. And I said, well, I don't know which one is more suggested than others, so I'm going to read them all. And they were textbooks, and they were all sorts of books, and great. And so I had some practice exams, and I was going to practice. I was going to study, and that's what I did. And I dedicated most of my time to that. But at the same time, I was inside of another practice. I knew a colleague of mine, great guy, chiropractor. It was 2 chiros. It was 2 physical therapists, 2 acupuncturists, and 2 massage therapists. And it was a beautiful practice. They had 1 front desk person that did all the billing and all that good stuff. I loved it. It was a great practice. I rented an office. Okay. So this is one way to do it. I'm going to share with you that. So when you work for another practice, they can do basically 2 things if you're actually in person. So one is they can rent you a space. The space can be for a few days per week, or a few hours each day, or they can also charge you a percentage of your appointments. So let me go over both scenarios. So they had 2 acupuncturists, and they had 1 room. So the acupuncturists actually alternated days, and one came in for half a day and the other came in for the second half of the day on some of the days. So it's a great way as a practitioner to do that, because then that room is always booked. Makes sense to me. I ended up doing that later when I opened my practice, my second location in 2012. I'll talk about that in a moment. Okay, so then same with the massage therapist. They had 1 massage therapy room, and they had 2 massage therapists. So all they did was alternate days. That's all. So they alternated days. And then for me, the physical therapist had an open space, so they were working that. They had a pelvic floor therapist, and I think one other like personal trainer / physical therapist. Okay. Then there's the 2 chiropractors. The 2 chiropractors had their own office because they were there full time, and they had 1 office left. And I said, great. I need an office outside of my house because I didn't have an office in my house at that time. I had my first location, which was a studio. And whenever I'm in the studio, guess what? Couldn't study because people had questions. I totally get it. I understand. I had a glass door, like people could see I was there, so I was getting interrupted. So I needed a quiet space. Certainly, I could go to the Boston Public Library, which I did for much of my time, but I wanted my own space, and I also wanted to start seeing people. So I wanted to start seeing people slowly. So I would see 1 or 2 people a day. That's all that I wanted to do maximum while spending that time studying. Okay. So what I did was I said, here's what I'm planning on doing. Is there a way that I could ramp up my rent over 4 months and then start paying the full price that you want the 5th month? And they actually said, yes, the room's been vacant now for, a few months. And so I just negotiated that. And so I don't know how much the office was, but let's just say it was $1,000. I'm just making up that number. So now at 2 appointments per day, you can just kind of do the math on that. Let's just say I was making $150 per appointment, right? Okay, so I was making $300 a day times, let's say 5 days a week. So 300 times 5 is 1,500. So I was making $6,000 a month. That was probably right around there, maybe $5,000, $6,000 or so a month I would make. Okay, great. And again, that's not all the income I was making because I had my first location. But anyway, I just want to share that. So when we look at that, I was paying $1,000, and let's say I was earning $6,000. Okay, so now I get to keep $5,000. And they get to keep $1,000. And that is one way that practices work. And it's actually, it can be a pro and a con, and I want to explain that. So for me, paying $1,000 would be a lot of upfront overhead. For them, it would be a decent amount of rent when you multiply that by one massage therapy room, one physical therapy area, one acupuncturist room, right? That's what they had. Then each of the chiros got to keep their own income because they each had their own room. They were partners basically. And then there was one for me. So let's say that they were charging each room $1,000, which they very well could have per month. And again, I'm just making up that number. I think it was higher, but anyway. So that $4,000 most likely paid for their rent for that location in Boston because it was just an office building up on like the 5th floor. So it wasn't like a high rent area. It was just an office building, 5th floor, send people to this location and you're good to go, right? So that $4,000 probably paid for the rent, which is great. So now the two chiropractors got to keep their own income after paying for the front desk person, which they split. Pretty fantastic, right? I mean, that's a great way to do it. Now, here's the downside. The downside is if they charged per appointment for the acupuncturists, myself, massage therapists, and physical therapists, and those people were busy, and let's say all combined, when everybody was busy, they were doing, let's just say 200 appointments a month, kind of going on the low end, but let's say it was 200. And they charged, I don't know, $50 per appointment, they'd be making $10,000 a month. And that's not necessarily unreasonable. It might be maybe a little high. If it was $30 per appointment and they were doing 200 at $6,000, so they're still earning $2,000 more per month, right? So like that's definitely doable. Like 50 appointments per month among two massage therapists, that means they're only doing 12 a week? That means they're only doing 6 each. That's like 1 a day. So obviously these are really low numbers. So I understood that and I thought about that. And that is why you as a practitioner, if you believe you're going to be busy, you don't want to pay per appointment, right? Because here's what happens. If you're going to do, let's even say like I was doing, or when I started getting going, which I was doing 4 to 5 appointments a day, and before I opened my own location, let's say you're doing 3 appointments a day, okay? So 3 times 5 days a week is 15. That's 60 appointments per month, right? So 60 times, let's say it's, I don't know, sometimes they do a percentage, but let's just say it's times $50. That's going to be 60, that's going to be $3,000 in rent, okay? Now, let's say it's per percentage, and you charge, let's say $150. Now I'm starting to do hard math for myself here. All right. So we're going to make it easier math just on the podcast. 200 times 30%, right? So $200, and every time you're paying them 30%, which is common. You're paying 30%, and now you're paying out $60 per appointment. You're making $140. It's not necessarily bad, and this is what I shared on IHP Mastery, if they're getting you the leads. So if they refer you clients, I would gladly pay 30%. Now, at $60, it's a lot of money, but you made $140 and you had $0 before that, right? Because you had 0 clients. So there are different ways to look at this. When you're first starting out, I mean, if you can make $100 per appointment and you even have to pay $100 or whatever, $80, it's not bad because you're getting new clients. And that's extremely important to look at that way to build up your business. So when you walk into an integrative practice, and let's say it's medical doctors and nurses, and they're starting to give you clients, don't feel bad about paying that referral fee because truthfully, they're getting you clients, which is one of the hardest things to do just to get started, right? Like that's the big thing. So once it's to your advantage in the beginning to actually pay a percentage or to pay a straight dollar amount per appointment, like $30 or $20 or whatever it might be. I did that even with personal training back in the day. So in like 2003, I left the high-end gym I was working at, and I started to train on my own. And one of the places that I trained at was actually right across the street from the high-end gym. And some of the clients that I work with, this place wanted 30% of all of the revenue that I was making. And so I was like, this is not ideal. However, it allowed me to charge really whatever I wanted, knowing that 30% had to go to this gym. So that's what I did. And so when you look at that, let's say I was charging, well, let's say at the gym, I was probably making like $35, before. And let's just say I charged 100. Okay, well now I'm making 70. I'm making twice as much money and I'm giving 30 to the gym. So there's a lot of different ways that you can slice this. The last thing I want to share with you is this though. You need to make it a win-win. When you're working at another practice, sometimes you're only thinking about yourself. And I get it, right? Like you're just starting out, you're trying to make your own income. I totally understand. If it's not worth it for the practice and they're only making like a couple $100, like maximum, and they're giving you a room or something like that, in the end, it's not going to work out. And you want it to work out, at least for a year or two, right? Like I worked at this integrative practice for a year, maybe a year and a half, because it took me 6 or 7 months to build out my space in Boston. And so I built up my clientele. I was building out the space at the same time, and it was only like a 10-minute walk away, so I could go check on it, go back and forth. And then I basically just took my clients and just transferred over there. And I was very upfront. Like I signed a 6-month commitment with them. And then after that, they said, okay, how things work? And I said, great. I was like, things are going well. I think they actually raised the rent. And I said, okay, I'm willing to pay the extra. And I said, I'm going to commit for another 6 months. And they said, great. And then when I knew my location wasn't going to be done, I then just signed on to say, hey, here's what I want to do it until. And then I left like a 30-day buffer. And they were good with it. And here's why. I wasn't competing with them. Meaning like they're chiropractors and other people. And I ended up continuing to refer many of my patients or my wellness clients to them as chiropractors. And so what you always want to do is think win-win-win, right? Client wins first, then the place that you're employed at, and then you. Because if you do that, everybody's happy. So all you need to do is say what works best for you and the practice, right? And then figure out then how much you need to charge from there. So if they do charge you $1,000 to rent that room full time, all you need to think about is, okay, what's my break even? Right? And I'll probably do a separate show on this because I don't want to start, breaking down what's break even, but just think about it. If you're making on average $200 per client per month, maybe it's $180 for your package, plus you may earn $20 and whatever else it might be. Think about it this way. You need 5 clients. So you need 1.2 appointments per week. That's it, right? So you only need an appointment per week, then that's your break even. So everything over about 1.2 clients per week or 5 appointments per month, everything after that is profit to you. So that's a pretty good deal. But of course, in the beginning, if you have 0 clients, well, then that's $1,000 overhead that it's difficult to pay for. But if you know that you're going to be able to work with 5 clients a month, then that pays for your space. Hopefully you develop relationships with massage therapists or the doctors, whoever's in that facility, and maybe then they start giving you referrals. So what I did was I worked with every single person in that facility for free. They paid for their labs, as I've talked about before. You go back a couple shows, check out that show is how to build up your clientele. But then they knew what I did. And since they now knew what I did, which is probably the biggest takeaway from this whole show, then they could refer people to me. And I got lots of referrals from them. And you know what? They didn't even charge me for any of those because they were charging me rent. And so it worked out amazingly well. I could then refer to them and we could work together. It was a beautiful business. And it's actually what I then took with me to then when I was opening up my new location. So always think about this. In the beginning, it's easiest to pay a percentage or a flat fee per session because you just build it into your appointments. But as you get going, it's actually more advantageous to pay a smaller flat fee once you have the clients because it costs you less. So hopefully this was helpful. All the show notes, all the big takeaways will be at stephencabral.com. So it won't be at stephencabral.com. It'll be at ihp.coach/314. And remember, every single show is based on your questions, your comments. So keep it coming. We want to help you succeed. We want this to be the year that you break out and have your best year yet. Take care, everybody. Appreciate you. Thanks so much for being a part of this community.